I'm Lauren Cochran, the Director of Clinical Faculty Development with CUNY School of Medicine, and in this video I'm going to share with you 5 ideas for giving your student a richer, more active learning experience when time or other factors don't allow them to complete independent HMPs and give full presentations. We'll call this Shadowing 2.0. Clinical teachers are always busy, we need to provide efficient patient care, but we also want to utilize effective teaching practices. So the goal is to find the intersection. Our first strategy is called activated demonstration, where you prime the student to observe you performing a specific patient care skill and then can discuss briefly afterwards. This works particularly well when a student is new to a clinical setting or is inexperienced with a particular issue. I'll use the HEADS adolescent social history as an example from pediatrics. Let's say Dr. X has a new peds clerkship student in clinic who's not familiar with the HEADS assessment. Dr. X could sit down for 10 minutes to walk the student through every part of the assessment, or she could ask the student to observe her interview the patient, observing the types and order of questions, the specific language she uses to ask about more sensitive topics, etc. After the visit or at the end of the session, she could then do a quick debrief and answer any of the student's questions. Can you think of any clinical skills in your patient care routine that would be well suited to teach via activated demonstration? The second strategy I'm calling shared decisions. Instead of just saying, you can come with me to see this patient and having your students sit idly in the corner, consider assigning them in advance a decision you want help with, such as, I'll take the history for this patient with X concern, and then we'll step out of the room for 2 minutes, and I'd like to hear your top 3 differentials and why. You can imagine how this assignment would focus a student's attention and clinical thinking during the encounter. Another variation, when a decision doesn't seem appropriate, is simply to ask the student to scribe while you interview, and then later you can discuss the case as one or both of you type up a formal note. The third idea is to use a shared encounter as an opportunity to briefly observe your student performing any small piece of the history, physical exam, or information sharing with a patient. We're talking literally 1 to 2 minutes. You let them know in advance that when we get to the family history, I'm going to turn the interview over to you. Or, I'd like to observe you do the HEENT exam, and then I'll do my full PE. Or, do you feel comfortable explaining to the patient how to take this antibiotic and possible side effects she should be aware of? And then afterwards, typically once the patient is no longer in the room with you, you can provide just 2 pieces of feedback, one aspect done particularly well, and one suggestion for improvement. It's really remarkable how much we sometimes learn from even just 1 or 2 minutes of observation. Idea number 4 is targeted research or writing. This is useful when you really need to see a patient on your own, or maybe there are no new patients to see for the moment. Rather than telling your student to go read, consider coming up with a research question based on a patient seen earlier. For example, we prescribed X medication for our last patient, but Y and Z meds are also sometimes used. Would you be willing to search for any evidence-based guidelines on this and then share your findings with me? Or earlier you mentioned that you were unfamiliar with Osgood-Schlatter disease. Why don't you take the next 15 to 20 minutes and review this article, and then we can talk about it. The idea is that you're helping to guide their self-directed learning. Another option is simply just having the student write a patient note for a case seen earlier that day, and later giving some feedback. We're finding that our typical clerkship student is not actually getting much experience with note writing, and we all know how important this will be for residency and beyond. And our last idea is to utilize patient field trips as learning experiences for students. Whatever your clinical practice setting, patients are likely interacting with non-physician health professionals from whom students can learn a lot. It can also be really nice for the patient to have some company and support. For example, the student could accompany their patient to a radiology study, or to the lab for a blood draw, or could observe any inpatient therapy session like PT or a respiratory therapy eval. So the next time you're about to have your student shadow or tell them to go read, think about these 5 strategies and whether any of them might be useful. Thanks very much for your attention.